Thanks, Melissa, and thanks to the Cancer Council and to Healthway for inviting me to come to Perth and spend the last week as well as this week. And thanks to all of you for coming out to hear about this today. So when you start to think about cancer prevention, how many people immediately start to think about economics? A couple. That's not bad. All right. So I'm going to talk a little bit about the work that we've been doing in this area, which really gets into to some of the economic influences on health behaviors and how those behaviors contribute to cancer and other non-communicable diseases. So I'm just briefly going to touch on the health and economic impact of these non-communicable diseases, how that's been changing over time, and then talk about a lot of the work that we do, which is really looking at how to use fiscal policy to try to promote healthier behavior in a way that's going to reduce cancers and other non-communicable diseases. And then specifically focus in on the work that we're doing around a few different types of tax policy. So tobacco, where we have considerable experience, alcohol, where we have similar experience, but haven't seen the same sort of action. And then sugary beverage taxes, which is a new area where governments are starting to think about using these taxes to promote healthier diets and better outcomes. And then the last thing I want to talk about are just some of the myths about the economic impact of these taxes. Whenever we talk about increasing taxes on tobacco or alcohol or imposing a sugary beverage tax, the industries argue about all the bad things that are going to happen to the economy if we do that. So I just want to talk about some of those arguments and some of what the actual evidence is on the impact. So when it comes to the health and economic impact of non-communicable diseases, one thing we know is that this is a really rapidly rising problem globally. About 67% of all deaths that occur currently are caused by non-communicable diseases. Cardiovascular disease is the single biggest contributor. Cancer is the second biggest contributor there. And if we look at what's happening in younger people that are still in productive middle age, what we see is that cancers are even a bigger share of the total there. So about just over a quarter of all the deaths that occur from NCDs among people that are under 70 are going to be attributable to cancers. The one thing that we've seen over the last decade or so is that this has really become a global problem. It used to be something that was really primarily happening in high-income countries, but over time, as health has improved in low- and middle-income countries, as they started to adopt a lot of the same unhealthy lifestyles that we have in high-income countries, what we've seen is that the burden of disease from non-communicable diseases has really shifted to low- and middle-income countries. About 3/4 of all the deaths that occur now from these non-communicable diseases are in low- and middle-income countries. In addition to the health burden, we know that there is a huge economic burden imposed as a result of these non-communicable diseases. There's the healthcare costs that go into treating these conditions. Those are going to be enormous, growing rapidly, largely paid for out of publicly financed healthcare systems. We also see significant losses to the economic activity in countries, lost productivity as people are sick and miss time from work because of these diseases and as they die prematurely. One of the things that's become clearer is that we know that these behaviors contribute to poverty. So these are behaviors that are often concentrated in the lowest socioeconomic groups. But they actually contribute to poverty, as I'll talk about. And they really do account for a big part of the inequalities that we see in health outcomes between high-income populations and the lowest-income populations. And again, just given the spread of these diseases to low- and middle-income countries, what we're seeing is really an explosion in costs, economic costs, as a result of non-communicable diseases in these low- and middle-income countries. And the trajectory is pretty bad there. You can see it's rising exponentially as we go forward in time. So again, when it comes to non-communicable diseases, there are 4 that account for most of the deaths that are occurring globally: heart disease and stroke, diabetes, cancer, and chronic lung diseases. And when we look across the risk factors that contribute to these, there are really 4 primary behaviors that cause these different diseases. So tobacco use is the single biggest killer globally. Unhealthy diets, physical inactivity, and harmful use of alcohol contribute to a number of these cancer deaths, as well as a variety of other consequences from NCDs. So that leads me to the economic rationale for addressing these problems. This is my all-time favorite quote. So I don't know how many people know Adam Smith. So Adam Smith is essentially the founder of free market economics, wrote a book about 240 years ago called The Wealth of Nations. And in that book, he has this quote, "Sugar, rum, and tobacco are commodities which are nowhere necessaries of life, which are become objects of almost universal consumption, and which are therefore extremely proper subjects of taxation." So I've been pretty much, Adam Smith defined what I've been spending my life working on over the last 30 years. So started out working on tobacco and alcohol taxes, and in recent years have gotten into the issues around sugar taxes. So why do governments tax these products? The main reason is the same reason that they tax everything else, and that's to generate revenues. If we look historically, we see that that's the main purpose for tobacco taxes, main purpose for alcohol taxes, and it's because these are relatively easy ways of generating revenue. Few producers, easy to collect the tax. Demand is somewhat responsive to price, but when you raise the tax and raise price, you actually see increases in revenues despite the reductions in consumption. So a very efficient way of generating money. And you can see the quote there from Napoleon talking about the tobacco tax and saying, "This vice brings in 100 million francs in taxes every year. I will certainly forbid it at once as soon as you can name me a virtue that brings in as much revenue." So governments like these taxes because they raise revenues. This is a picture from South Africa. South Africa has pushed up its taxes on tobacco as part of its tobacco control efforts, pushed up prices, and even as they've reduced tobacco use, they've been very effective in increasing the revenues along that green line that are generated by those taxes. This is a picture from the U.S. where I come from. We haven't done the same thing with alcohol taxes. The opposite has actually been happening. We've allowed our alcohol taxes to be eroded by inflation over time. And as that's happened, we've seen the revenues that are generated from those taxes go down. The last time that taxes were increased, 25 years ago, when the tax was increased, we saw the revenues from that tax go up considerably. So again, very effective way of raising revenues. The reason we're here, the reason I'm interested in this is because of the impact on public health. One of the things that's become really clear over time is that increasing these taxes, increasing prices leads to reductions in the use of these different unhealthy products, and as a result leads to significant improvements in health. And those are going to happen particularly among some of the most vulnerable populations, so among kids and among low-income populations. So this is a quote from the Director General of the World Health Organization, talking about the effective strategies that WHO pushes for tobacco control and talking about how tobacco taxes are by far the most effective. And again, you can see that's in this picture. This comes from the U.S. So in the U.S., we've raised our taxes over time, driven up the prices of cigarettes, and as soon as prices started going up, we see consumption for cigarettes come down. And then within a few years, we start to see some of the health benefits. So here we're looking at the early onset of lung cancer among young men. We can see about 4 or 5 years after the tax increases, after the price increases, we start to see these reductions in cancer deaths caused by tobacco use. The last argument for why we do this is the economics argument. So the idea here goes back to a little bit of what I was talking about earlier. There are considerable economic costs that are imposed by these different behaviors. A lot of those costs are not borne by the people that are engaging in those behaviors. They fall on society more broadly, publicly financed health care, a lot of the consequences of things like exposure to tobacco smoke among non-smokers, the non-drinkers who are involved in traffic crashes and affected by some of the violence around alcohol and so on. So that creates an economic argument for why we want to put taxes on these products, basically to try to recapture the public costs of these behaviors. So we've been doing a little bit of work trying to figure out whether or not governments are generating sufficient revenues to cover these costs. This is a picture again from the U.S. In the U.S., we estimate considerable economic costs, over $200 billion a year, caused by tobacco. A big part of those, especially through the public health insurance programs in the U.S., are being paid for with public dollars, so being borne by all of society. But the taxes that we generate from tobacco are far short of what the economic costs to society are of tobacco use. We've started to do the same with alcohol. When we look at alcohol, the picture is even more bleak. Again, huge economic costs to tobacco or to alcohol use, including criminal justice costs and the costs associated with violence and a variety of other consequences of excessive drinking. And a big part of those are being paid for by governments. But the tax revenues that governments generate tend to be really, really small relative to these social costs caused by alcohol. So again, we've been doing a lot of work trying to look at how tax changes, how price changes influence these different behaviors. This is all basically applying the basic principles of economics. So when I started doing this work 30 years ago, there was a perception that tobacco use, because it was so addictive, would not be responsive to basic economic incentives. So the idea was if you raise price, people would continue to smoke. They give up something else to be able to continue to smoke. But what we found is that the basic laws of economics apply to all these behaviors. As price goes up, consumption goes down. And then we use a term called the price elasticity of demand to try to quantify that. So basically looking at how much consumption falls in response to a 1% increase in price. So when it comes to tobacco, we have the best evidence here. So over 200 studies from around the world at this point that have looked at the impact of taxes and prices on tobacco use, and very, very consistent findings across all countries. The first thing we see is that when taxes are increased and when prices are increased, we see reductions in overall tobacco use. This is a picture from New Zealand, and you can see that that's exactly what's been happening. As taxes have gone up and prices have gone up over time, overall tobacco use in New Zealand has come down over time. But then you can see there's some times when things aren't going up, when the tax isn't changing, when prices aren't going up anymore, and you start to see the reductions in tobacco use flattening out when price isn't rising. So we estimate that a 10% increase in price ends up leading to about a 4% reduction in overall tobacco use in high-income countries, and a bit more of an impact, 5 to 6% reductions in low and middle-income countries. We know that about half the impact of that tax and price increase comes in the number of people who smoke. So when you raise taxes, raise prices, the likelihood that people are going to use tobacco products falls. This is a picture from Brazil where we're looking at the same sort of situation. The Brazilian government has pushed up price over time with big tax increases. And at the same time as they've done that, they've been very effective in reducing overall smoking prevalence in Brazil. The changes that we see in prevalence come because people are going to try to quit smoking when prices go up. So what we see is that when prices go up, a lot of people are going to be interested in quitting. They're going to look for help to quit, and that's what's illustrated on this picture. So here we're looking at calls to quit lines in the United States. And what we can see is that when there have been big tax increases, our last big national tax increase was about 6.5 years ago. When that happened, we see a lot of smokers that are interested in quitting. They're calling the quit lines, looking for help to quit, using cessation products and trying other ways to quit. And in the end, what we see is that a number of them are actually successful in doing that. So this is just looking at the situation across states in the U.S. For researchers like me, it's sort of a nice situation. We have 50 different states. Each state applies its own tobacco tax. Taxes are as low as 17 cents a state, or 17 cents a pack in some states, as high as $4.35 in other states. So a lot of variability in taxes and prices. And what we see is that in the states that have the highest taxes, that have the highest prices, we see a lot more smokers who have been successful in quitting smoking. The other thing we know is that kids are particularly sensitive to changes in taxes and prices. Our work suggests that kids are about 2 to 3 times more sensitive, and it really gets them when they're moving beyond experimentation with tobacco and into more regular use, into addiction. So when kids start to experiment, they're not buying their own cigarettes, they're getting them from their friends, they may be sneaking them from their parents. But once they start to progress to more regular use, when they start to buy their own cigarettes, that's when they become much more aware of price, and that's when it has its biggest impact. So again, we could see the same story that I've been showing you in the U.S. when prices have gone up. That's been associated with big declines in youth smoking. We had this period back in the late 1990s where youth smoking was actually rising, and the big contributing factor was that the cigarette companies, led by Philip Morris, cut their prices for cigarettes, and as soon as prices went down, more kids started to smoke. So it wasn't until price started going up because of tax increases, because of litigation, the costs of which got passed through in price, As soon as price started going up, we started to see those reductions in youth smoking rates. The other thing we know is that low-income populations are particularly sensitive to price. Basic economics, again, people who are spending limited incomes on any product, when you change the price of that product, that's going to lead to more changes in their behavior, given the larger share of income that's accounted for by spending on that product. So this picture illustrates that. This is from Turkey. Turkey actually, several years back, used to be in the tobacco business. The main industry there was a nationally owned tobacco monopoly. Turkey got out of the tobacco business and got into the business of tobacco control and started to raise taxes, among other things. As they've pushed up taxes and prices, they've been very effective in reducing overall smoking in the lowest income parts of the population. You see reductions across the board, but the biggest impacts among the lowest income smokers. And then something I'll come back to in a little bit is that actually led to a reduction in the amount of tax that's being paid in this lowest income part of the population. So more of the tax increase actually falls in the higher income parts of the population. And then, like I said, all this ends up leading to real reductions in the consequences of tobacco use and improvements in overall population health. So I showed you the picture for the U.S., a very similar picture for France. The French government back in the 1990s decided that they were going to get into tobacco control, started by raising taxes, raising prices. As soon as they did that, they started to reduce tobacco use. And again, within a few years, you start to see the health benefits kicking in with reductions in cancer death rates. When the government changed, they stopped pursuing that tax policy. Prices started to level out, consumption starts to level out, and you can see the health benefits are starting to level out as well. Now, when it comes to alcohol use, we have the same sort of evidence that we have for tobacco. We see consistent evidence that increases in alcohol taxes, increases in alcohol prices lead to real reductions in drinking and also in excessive drinking, heavy drinking, that causes a lot of the health problems. There's a bit of variability across different types of beverages. Beer drinkers tend to respond less to changes in prices. Wine and spirits drinkers are more responsive to those changes in prices. And we see the same thing that we saw with tobacco in that young people tend to be most responsive to these changes in prices. So economists have looked at every different outcome that you can think of that's related to drinking and excessive drinking. So here we're looking at binge drinking prevalence rates. Binge drinking defined as 5 or more drinks on a single occasion for men, 4 or more drinks on a single occasion for women. And again, we have this situation in the U.S. where there are very different taxes on alcohol across states. And what we see is in the states that have the highest taxes, highest prices, we have less binge drinking. And vice versa. The states where taxes are low, prices are low, and there's a lot more binge drinking. A lot of the work that I did early on was focused on drinking and driving. Here we saw very similar evidence. As taxes and prices went up, we saw reductions in the likelihood that people would drink and drive, whether or not they got in traffic crashes, and then the fatalities that were caused in those traffic crashes. So again, we had that one big national tax increase that I told you about back in 1991 in the U.S. Beer taxes were doubled, other taxes were increased as well. And what we saw was that when those taxes went up, we got about a 21% reduction in the fatalities caused by drinking and driving. So again, big reductions in drinking, big reductions in its consequences. And we saw even larger reductions when it came to drinking and driving among kids. So here we saw about a 28% drop in the fatalities for 16 to 20-year-olds caused by drinking and driving in the U.S. We've looked at a lot of the other health consequences of alcohol use, looked at the consequences of chronic heavy consumption, things like liver cirrhosis, a lot of the alcohol-related cancers, more immediate consequences like alcohol poisoning. And basically what we see is the same pattern of results. As taxes are higher, prices are higher, we see reductions in all these health consequences of drinking. We've done some work looking at violence, looking at homicide rates and suicide rates, spousal abuse, child abuse, and the same basic things emerge. In places where taxes and prices are higher, we see a lot less of alcohol-related violence. And then some of the more recent work is focused on things like risky sexual behaviors. So we see sexually transmitted disease rates go down. We see teenage pregnancy go down when alcohol taxes are being increased. So there's been some work trying to summarize this. One of my colleagues, Alex Wagoner, did a systematic review of the evidence here and basically projected that if alcohol taxes in the U.S. were doubled, we'd see these sort of benefits across the board. We'd see significant reductions, 35% reductions in the overall mortality caused by alcohol. We see large reductions in traffic crash deaths, sexually transmitted diseases, violence, and other crime. So in recent years, we've seen a big increase in obesity in the U.S. It's happening in Australia as well. It's happening in pretty much all countries around the world at this point. So we started to look at taking the lessons that we've learned from tobacco and alcohol and looking at whether or not those would apply when it comes to obesity. So there has been a lot of work by economists that has tried to look at the effects of food and beverage prices on food and beverage consumption. We did a recent review that tries to summarize this evidence, and we see big price effects. So we estimated that, for example, if sugary drink prices were to go up by 10%, we'd get about a 12% reduction in consumption. We see fast food consumption also very affected by price, 10% increase in price, about a 5% reduction in consumption. But then we also see that the healthier products are also responsive to price. So fruits and vegetables, if you raise their prices, people are going to consume less as well. We started to look at these same issues globally. So what I've done here is to look at snack food prices around the world, looking at how those prices have changed over time, and then looking at how consumption of these different snack foods has changed in different countries. And estimate pretty much the same sorts of things that we see in the U.S. So basically places where prices have gone up by a lot more, we've seen bigger reductions in consumption. Places where prices have actually come down a lot, so we've seen big increases in consumption. So we see it with snack foods. We see it with beverages. So again, very, very responsive to price. Increases in prices for unhealthy products is going to reduce their consumption. So all this leads to thinking that maybe tax and price policies would be an effective tool for trying to deal with the rise that we see in obesity around the world. So again, I always, when I start looking into any of these areas, just go back and look at some of the basic data. What I've done here is to look at the data from the U.S. We've seen a big increase in obesity prevalence in the U.S. over time. That's the yellow line there, really increasing very rapidly over the last couple of decades. And I start to look at prices. So I'm looking at fruits and vegetable prices here, and it looks like the rise in obesity is paralleling the rise in the prices for fruits and vegetables. So that suggests to me that there's probably something going on there. We looked at the other side of things and see similar stories. We've seen sugary beverage prices, other carbonated beverage prices come down over time. We've seen the prices for sweets come down over time. So again, those reductions in the prices of unhealthy products seem to be happening at the same time as obesity is rising. So what we've started to do as economists is to try to then look at whether or not changes in the prices of healthy foods and unhealthy foods is leading to some of the changes that we've seen in obesity. And what we tend to see is that, yes, there is good evidence that increases in the prices of less healthy options and reductions in the prices of healthier options would actually lead to better weight outcomes. And it's very consistent with what we saw from tobacco, very consistent with what we saw from alcohol. Basically, kids are going to be more responsive, lower income populations are going to be more responsive. And we actually see the biggest impacts in the groups that are most at risk for obesity. So people that are already at high weights, already consuming probably a lot of these unhealthy products. If you change the relative prices for them, you'll see the biggest effects. So basically, we have two options here. It's a little bit different than the story with tobacco and alcohol, especially with tobacco. Everybody has to eat, so we can't just think about trying to tax some of these products out of the markets. So basically, what we're looking at is trying to alter the relative prices for healthy and unhealthy products, thinking about how to push up the unhealthy product prices and reduce the prices for the healthier options. In this work, we think about subsidies as a way of trying to reduce prices for things like fruits and vegetables. But the problem is that relying on subsidies by themselves is probably not going to solve the problem and may make it worse. So part of what we talk about is the idea that there's what we call an income effect as a result of these subsidies. So we know that when you subsidize fruits and vegetables, people consume more. But basically, it provides more resources. They have access to greater income than they would have had otherwise. And they spend some of that on less healthy options as well. So what ends up happening is that we see net increases in calories when subsidies are implemented without any sort of taxes on unhealthy products. So at this point, we're at the early stage in this compared to where we are with tobacco and alcohol, but governments are starting to think about using these types of policies to promote healthier diets and to try to reduce the obesity epidemic. So Mexico is one of the countries that's leading the way in this area. A couple years ago, Mexico adopted a sugary beverage tax where they put a peso per liter on, which has increased prices considerably. And it's also then led to reductions in sugary beverage consumption. At the same time as they did that, they imposed a junk food tax, so that a tax that's 8% of junk food prices. And again, that's having its impact on consumption. Denmark, another country that decided it was going to try to take this on. First country to levy a significant fat tax. So they tax foods based on their saturated fat content. Implemented that in late 2011. But then the industry argued that all the Danes were leaving Denmark, fleeing across the borders, buying their fatty products elsewhere to avoid the tax, and it wasn't having any impact. So they repealed that tax within about a year. The reality was that there was actually real reductions in consumption, probably would have been some benefits in terms of weight had they stuck with it. But we are starting to see these types of taxes take hold in a number of different countries. At this point, mostly relatively small taxes, but starting to move in that direction. I think sugary beverage taxes are the place to start. It's the one place where we can have the biggest impact. Sugary beverages have no nutritional value, a significant source of added calories for people's diets, particularly kids' diets. And there's good evidence now that shows that consumption of these sugary beverages does lead to obesity. So a lot of work that suggests that beverages, for example, aren't satiating in the same way that foods would be. So that people don't reduce their caloric intake from other sources when they're increasing their consumption of these beverages. The other thing is we know that consumption leads to a number of other health consequences directly as well, independent of obesity. So increases in type 2 diabetes, a variety of dental problems, and other sorts of problems that are caused by sugary beverage consumption. This just gives you a picture of what's happening around the world in terms of consumption of these sugary beverages and in terms of obesity rates. So if we look at the high end here, the U.S. and Mexico are the two that keep going back and forth in terms of being the biggest consumers and also having some of the biggest problems with obesity. But Australia is actually pretty high there as well, one of the higher consuming countries, one of the countries that has relatively high obesity rates compared to the rest of the world. So again, a pretty clear link between beverage consumption and obesity. The other thing that's going on is very consistent with that story I told you about the U.S. earlier. What we're looking at here is the affordability of these products. So basically looking at how prices have been changing for sugary drinks relative to incomes. And what we see in virtually every country around the world is that the prices of these products have fallen relative to income. They've gotten much more affordable. And that increase in affordability is really a big part of what's driving the increase in consumption. There's one outlier here, that's Japan. It's not that Japan has done anything to try to raise sugary beverage prices. They've just had a fairly stagnant economy over the period that's looked at here. So it's really incomes are going down, not so much the prices are going up. So we've been doing some work in the U.S. to really try to look at whether or not taxes on sugary beverages would have a real impact on consumption. The problem in the U.S. is that we don't have real focused, comprehensive taxes on these products. So again, in the U.S. we have states that tax these products. They use their general sales tax. The sales taxes in the states tend to be small, so we're talking about taxes that are on average 3 or 4% across states. So relatively small taxes are going to have relatively small effects on consumption, probably not going to show up in terms of an impact on weight. The second problem is that they don't differentiate between the sugary versions of the beverages and the non-sugary versions. So what we see is that diet soda, regular soda, taxed at the same rates, so you're not getting the substitution that would be ideal to try to promote healthier weight options. And then they generally are not comprehensive. So states may tax carbonated beverages, but they're not taxing things like sports drinks and energy drinks and fruit drinks and things like that that are considerable sources of calories. So again, a lot of variation across the states in the U.S. in these taxes, some that don't have any, some that have taxes as high as 7 or 8%. And then, they're taxing some of the healthy products at the same time. So a lot of the states are taxing things like bottled water. So again, if you're really trying to use these taxes to try to promote people to switch from less healthy drinks to healthier options, this wouldn't be a very effective way of doing it. So we have spent a fair amount of time talking about how these taxes should be levied if they're going to have their real public health impact. A number of different things come out of this, but basically we emphasize excise taxes that are based on volume or based on sugar content, very similar to the sort of tobacco taxes that we have that are based on the number of cigarettes or the weight of the tobacco. Those types of taxes are going to be easier to administer. They're going to reduce the incentives for people to switch to the bigger volumes. They tend to have a significant quantity discount attached to them. And they also generate more stable revenues that are independent of the industry's pricing decisions. So again, there seems to be a lot of evidence on the tobacco side, alcohol side. We're getting the same evidence when it comes to using fiscal policies to deal with obesity. And what we see is that, at least when it comes to tobacco and alcohol, governments are taking this on. So almost all governments around the world tax tobacco products. Those that don't, it's basically because they're importing almost all their consumption, imposing import duties instead. Almost all governments tax alcoholic beverages. But when it comes to the policies I've been talking about on the food side, very few countries are taxing things like sugary beverages. Fewer are taxing things like junk foods. Relatively few are subsidizing healthier options. And we do have a few countries that are subsidizing different types of physical activity as well. But again, relatively few countries that are using fiscal policy to try to deal with their obesity epidemic. So I guess when it comes to the reluctance of governments to pursue these policies, a lot of the arguments against them come down to their economic impact. So the industries in these different areas use basically the same arguments as to why raising taxes or imposing taxes on these products would have a negative economic effect. So they talk a lot about the fact that it's not going to have this sort of public health impact that I'm talking about, that it's not going to generate the revenues that I've talked about. But I think the evidence there is really clear. A few things that they do spend a fair amount of their time arguing are that it's going to lead to a lot of illicit trade. A lot of people are going to try to avoid the tax if they can. It's going to lead to a lot of large-scale smuggling, and that's going to offset any benefits that you would get from the taxes. A second argument is that it's really going to be harmful to the lowest income consumers, particularly in populations where a lot of people are consuming on low incomes. And then the last one is that it's going to cause significant job losses. So as people reduce their consumption, a lot of the people that are involved in producing these products, distributing them, selling them at retail, are going to lose their jobs as a result. So we've been trying to look at the evidence and see what it really shows on these different issues. So when it comes to tax avoidance and tax evasion, we have a lot of work that's been done around tobacco. Again, that's where the biggest taxes are. That's where this argument gets made most frequently. And what we see is that even if there is this sort of illicit trade, even if there is some tax avoidance, tax evasion, we still see real public health and real revenue benefits from tax increases. So this is a picture from New York City. New York City has the second highest tax in the U.S. Between the state and the city, they've pushed their tax up to the point where it's $5.35 or $5.85 a pack now. And as they've pushed those taxes up, they've seen real reductions in youth smoking prevalence and in adult smoking prevalence. And that's despite the fact that about half the cigarettes that are consumed in New York either avoid or evade the local tax in New York City. So again, significant tax avoidance, significant tax evasion, but still real public health benefits. This is the picture from where I come from, which is Chicago. Chicago has the highest taxes in the country. Our tax is $6.16 a pack at the state and local level. We have a state right nearby that's 99 cents a pack, Indiana, about 15 miles away from Chicago. If you go a little further, our neighbors to the southwest in Missouri have 17 cents per pack. So a lot of opportunities to avoid and evade the tax. Taxes are, again, about half the market in Chicago is accounted for by illicit products. But what we see is that as those taxes have gone up, we still see revenues going up. So despite the tax evasion, tax avoidance that's happening, revenues go up. If we look at what's happening around the world, we see that tax and price really don't seem to have anything to do with the levels of illicit trade in tobacco products. So what I've done here is to look at the size of the market, or how much of the market is accounted for by illegal cigarettes, cigarettes that have evaded tobacco taxes. So that's the market share of the illicit cigarettes. And down here we're looking at price, which largely reflects the tax levels in these different countries. And what we see is the opposite of what you would expect if it was really tax and price that was driving illicit trade. So what we see is that the countries that have some of the highest taxes and prices in the world actually have the lowest levels of illicit trade, and it's countries that have relatively low taxes and prices that often have the biggest problems. So you can see Australia, some of the highest prices in the world, some of the lowest levels of illicit trade, less than 5% of the market at this point. What really explains this is the strength of governance in countries. What we see is that countries that have effective tax administration, that have good customs controls, that don't have a lot of corruption, these are the countries that are going to have relatively small problems with illicit trade. And it's the countries where that's not true, where there's weak tax administration, where the borders are porous, where there's a lot of corruption, that have the biggest problems. So again, we tried to look at this using some of the evidence from around the world. Our measure of strength of governance here is what we call the transparency index, so how transparent the government is, how little corruption is happening in these different countries. And again, now it's very consistent with what we would expect. The countries that have the strongest governance have some of the lowest problems with illicit tobacco trade. And then the other bottom line here is that if governments are serious about this, they can really deal with this problem. So I think Australia has done a really good job. Australia has had effective controls, effective tax administration, very low levels of smuggling. But what we've seen is in countries where they've had big problems with illicit trade in the past, they've actually been able to crack down on that and all but eliminate it. So this is a picture from Spain. Spain, about 25 years ago, used to have some of the highest levels of illicit cigarettes in the Western European area. About 1 in 5 of all the cigarettes that were being consumed were evading the tax. And they also had some of the lowest taxes and prices in the region. But what they did was decide to get serious about taking on that illicit trade. They started to enforce their tax laws, a lot more aggressive enforcement. They worked with their neighbors to try to help close the borders, dealt with a lot of the large-scale smuggling in particular, and basically all but eliminated it, got it down to about 1% of the market through this aggressive effort. And at the same time as they did that, they were actually able to raise their taxes and raise their prices. So again, if countries want to deal with this problem, they can crack down on it and they can address it. There's a treaty that we have in the WHO called the Framework Convention on Tobacco Control. It's the world's first public health treaty. Talks about all the things that governments can do to deal with tobacco use. And one of the key additions to that treaty was an independent treaty that was adopted a few years ago called the Illicit Trade Protocol. So the idea here is that this is a separate treaty. Governments are going to then be obligated to dealing with illicit trade in tobacco products. It's something that's in the process of being ratified currently. But it basically takes the best practices that we've seen from countries that have dealt with these issues and talks about how to implement that. So talks about the importance of strong tax administration, using some of the technologies that we have available to track and trace tobacco products as they move through the distribution chain, talks about the importance of enforcement, talks about the importance of strong penalties on people that are involved in illicit trade, and really emphasizes the need for countries to work together, as well as within countries for different agencies to work together to address this problem. The next argument is the idea that somehow tobacco taxes are going to harm the poor. The problem here is that these are regressive taxes. Given patterns of consumption, We know that the lowest income populations are the ones that bear the heaviest burden of these taxes, given that that's where a lot of the consumption is concentrated. So the taxes themselves are regressive, but the tax increases can be progressive. So if you think back to the picture I showed you for Turkey earlier, what we see is that low-income populations reduce consumption the most when tax and price go up. As a result, the health benefits are going to be progressive. Most of the health benefits are going to accrue to those low-income populations, and the burden of the tax increase is going to fall on higher-income consumers. So again, we've been doing some work looking at different countries around the world, trying to look at this trade-off between the financial impact and the health impact. We've created something that we call the health tax ratio to try to look at how this plays out, particularly for the lowest income parts of the population. And what we see is that it's almost universally true. You're going to see this progressive health effect and progressive financial impact of tobacco tax increases. The other key thing that matters here is in terms of what happens with the revenues that come from these taxes. So I talked about the idea that these are very effective ways of generating revenues. And the key thing here is to use some of those revenues to help the low-income populations that are most affected by those tax increases. So if you think about tobacco tax increases, when the tax goes up, low-income smokers are going to be the ones that want to quit the most. They typically have the least access to cessation resources. So the idea here is to use some of those tax revenues to help support efforts for low-income smokers to quit. When we do that, we see much more public support for these types of tax increases. Smokers themselves, actually, a majority of smokers will support a cigarette tax increase when the money from the tax gets put back into cessation programs to help low-income smokers quit, and when it gets put back into programs to keep young people from taking up tobacco. The other thing that can be done to offset any impact on the poor is to use some of those revenues to support programs that specifically target low-income populations. I think the Philippines is the best example in recent years where this has been done. They went through a process of reforming their alcohol and tobacco tax system a few years ago, really pushed up taxes on alcohol, pushed them up a lot more on tobacco, generated a lot more revenues, and those revenues are going into a universal health care program in the Philippines. So now everybody has access to health care as a result. So again, that's going to offset any financial impact on low-income families. The last argument is in terms of the impact on the economy. The industry will tell you about half the story here. They'll talk about all the reductions in employment in their industry as a result of the tax increases and the reductions in consumption. They then inflate that quite a bit to argue that the jobs that are generated in this industry generate a lot of other jobs throughout the rest of the economy. But what they don't talk about is what happens when those taxes go up. So in addition to reducing consumption, people who used to buy those products don't just bury the money that they spent on them in their backyards. They use that money, they buy other goods and services, and create jobs in other parts of the economy. The government takes the tax revenues that are generated, puts those back into activities that tend to be very labor-intensive. That creates jobs in other parts of the economy as well. So there's been a lot of work in this area for tobacco. Started about 20 years ago in the U.S., and a number of other countries have seen the same sort of research at this point. And what we see is that there are job losses in the tobacco sector that are more than offset by job gains throughout the rest of the economy. So in the end, the overall impact on economic activity is positive. We've just started doing some similar work in the U.S., looking at beverage taxes, both alcoholic beverage taxes and sugary beverage taxes. Again, the same arguments come up about the negative effects on jobs. But what we show is that, at least with regards to state taxes, increases in these taxes or imposition of these taxes would lead to job losses in the beverage sector, relatively modest, that would be more than made up for by job gains in other parts of the economy. So again, to summarize all this, we have a lot of evidence now from around the world that clearly shows that fiscal policies can be used to promote health and reduce the consequences of unhealthy consumption. So higher alcohol taxes, higher tobacco taxes, sugary beverage taxes, reduce the consumption of those products, improve health, reduce all the non-communicable diseases that are caused by consumption. When it comes to those economic arguments, there's basically either a grain of truth to them that's overstated, or they're completely false. So at the end of the day, what we've come to realize is that taxes are one of our most effective strategies for promoting public health and one of the best buys when it comes to non-communicable disease prevention. So we've been doing a bit of work trying to look at cost effectiveness of different strategies for reducing NCDs. This is the picture for tobacco, and you can see that across the board, all income levels, low, middle, high income countries, tobacco tax increases really are the most cost-effective strategy we have. Relatively low cost to implement, big impacts, highly cost-effective. And we see the same thing for a lot of other interventions, things that Australia, among others, have done. But again, taxes are the best buy here. So that was a lot of information in a short amount of time. We'll have a chance to talk more about it, I think, over the next 15 or 20 minutes. And if you're interested in keeping up with the research that we're doing, we've got a couple of websites. You can follow us on Twitter for those who do that. And I'm always happy to answer anything that anybody has by email. So thanks for listening. So I think we have a roving microphone to go around. And
that's great. Thank you so much, Frank. That was fantastic. Have we got any questions from our audience?
So everybody's convinced. How many people like a sugary beverage tax? About half and half. How about tobacco tax? Almost everybody likes tobacco. Alcohol? Alcohol is a bit of an issue in Australia with the presence of the wine industry. All right.
Thanks, Professor. Just a quick question about the notably low rates of consumption in California. Do you think they're due to taxation?
In California?
Tobacco consumption, sorry, yeah.
Tobacco. So in California, what California has done is part of what I talked about. So California has increased its taxes a couple of times in the past. And what they did when they did that was to take a lot of the revenues, put them back into a comprehensive tobacco control program. So they got the reductions in tobacco use from the tax, but then they got bigger reductions because of the program that was funded by the tax. They haven't done so well recently. They haven't raised their tax in 16 or 17 years at this point. So they've kind of fallen behind the rest of the country, but they still have low rates just because of the effectiveness of their program. Some of the numbers from California suggest that for every $1 they've invested in their tobacco control program, they've actually reduced healthcare costs by $4. So big return on investment as a result.
Thank you. I enjoyed your talk very much. I just wondered whether, with taxation, which is a very sensitive issue in nearly every country because of the politics involved in it and re-election of politicians, I wonder whether your work has led you to have an understanding of how the politicians deal with this very sensitive topic, because they want to be re-elected on a 3, 4 or 5 year cycle, and do they select particular times to introduce taxes so that it's all forgotten by the time it comes around to election, or are there other factors involved?
I think there's a couple of different things going on. So one of the things that we try to demonstrate to politicians is that, for them, this is really what we call a win-win-win. So they get the public health benefits, and a lot of politicians will use that as cover for the increases in revenues that they get from the tax. So they get the public health benefit, they get the revenue benefit. But these are actually relatively popular taxes. So when you do public opinion polling and you ask people about whether they would support a tobacco tax or a sugary beverage tax, you generally see a fair amount of support for that. But you see much more support when you frame it in terms of using the revenues to then put it back into dealing with the problem that the tax is supposed to address. So if the money from the beverage tax goes back into childhood obesity prevention programs, you get big support. So I saw some of the public opinion data from Australia. 84% of Australians say that they would support a beverage tax if the money got put back into childhood obesity prevention programs. And you see consistent support across the board depending on how the tax revenues get used. Like I said, with tobacco, we actually see a majority of smokers support the tax when the money goes back into tobacco cessation and prevention programs. So smokers know how addictive it is, how hard it is to quit. So if they think the revenues are being used to keep kids from taking up smoking as well as to help smokers quit, they support it. So all that you would think would motivate politicians to push these taxes. The industry has a huge, powerful lobby, which keeps them from doing that as much as I think would be appropriate. No politician is going to raise taxes in the year leading up to an election. That's just going to come back to haunt them. But a lot of times after the election passes, that's when we see a lot of the activity really starting to happen. So yeah, there is that sort of cycle to the taxes.
One just up the back there. Yeah.
Just wondering with the obesity issue, and you spoke about sugary beverages tax, but why not just tax sugar at the source?
Sugar taxes would be a good option. So, I think the issue there is that gets to be much more difficult politically. So I think, taxing sugar, which goes into almost all processed foods at this point, ends up being a bit more of a problem. So that's where I think the sugary beverage tax is probably the cleanest one. It's a category of products that has no nutritional value, that is a significant source of calories, and that is relatively easy to tax. So yeah, a more broad-based tax, something that would tax the different unhealthy components of foods, including sugar, would end up having a bigger impact on weight, just a lot more complicated administratively and a lot more challenging to get through politically.
I'm probably one of those who think that sugar is actually not so bad if you consume it in moderation, and as is alcohol. So I'm wondering if there are cases where we implement a tax but also a rebate so that people like me who don't consume a lot do not actually are not impacted in a negative way economically by these taxes.
Yeah, so the rebate scheme gets a little challenging. So part of what we've been doing is trying to look at who pays these taxes. So a lot of our work has come around alcohol in this area. So again, the moderate drinker is going to have to pay that tax as well. They're not the ones that are causing a lot of the social consequences. They're not causing the health consequences. And what we see is that it's really a fairly modest impact on their budgets. So we've looked in the U.S., for example, at what would happen if we were to impose a 25 cents per drink tax on alcoholic beverages, and who would end up paying that tax. And what you find is that the moderate drinkers, they do end up paying a little bit. It costs another $10 or $20 a year, which is a fairly low amount relative to their overall spending. But it's the heavy drinkers, the ones that are imposing most of those costs, that end up paying most of the tax. So the idea is most of the tax falls on the people that are causing most of the problems. Yes, there is going to be some impact on people that are moderate consumers, but at the end of the day, the impact there is going to be relatively small. And I think over time, it's actually going to pay off in terms of the reduction in those public costs that are attributable to these different problems. So yeah, trying to set up something where we provide a rebate, that gets really difficult. Other questions? All right, so everybody's going to go home and write your legislators to talk about the importance of a sugary beverage tax, right? All right, thank you.